Hi, today I'm going to talk about COVID and diabetes and give you a few updates. What I am not going to talk about is all the wonderful news about vaccines and potential treatments for COVID, but I'm going to give you some good news about diabetes. So first of all, good news is that we've learned that telemedicine works for helping people with diabetes. Now, we always thought it would work, but now we know it works. So we have studies from Spain, Italy, the United States, and many other countries that basically shows we can provide equivalent or even better care through telemedicine than in person. Now, this means we're good at managing glucose levels as long as we have data. And we have to be able to do true remote management, which means we need to be able to get the data from our patients in order to help manage their blood sugars. But I think it's very important to prove that we can do that and do that effectively. We've also shown that we can use continuous glucose monitors in the hospital. So ever since there was the emergency ruling passed that the FDA allowed CGM to be used in the inpatient setting, a number of hospitals have implemented CGM, and in settings where there have been specific protocols for its use, they have shown that this is quite helpful, and I'm hopeful that we'll be able to continue to use CGM in hospitalized patients. The CDC originally said that all people with diabetes were in the highest risk group for doing poorly with COVID. Now the CDC has divided the types of diabetes into two groups. So they still say that people with type 2 diabetes are in the highest risk category, but those with type 1 diabetes are in a slightly lower risk category. And I think for both groups, most of the available data suggests that better glucose control is associated with better COVID outcomes, particularly in terms of lower risk for hospitalizations, intubation, and death. So good control matters, and that's something I've spent a lot of time in the past few months trying to help patients achieve. Now, there are some bad things, and one of the things that really worries me is that telemedicine is great in all sorts of ways, but we're missing certain important findings. There was a very good retrospective chart review study that was published recently in the Journal of the American Podiatric Medical Association that looked at patients who were seen by a foot and ankle surgery service during the first 8 months of the pandemic. And basically what they found was that any level of amputation was 10.8 times higher during the 8 months of the pandemic than prior to the pandemic, and that the risk of major amputation increased with an odds ratio of 12.5. They also showed that there was an increase in the severity of infections in the patients that they saw. So this is very serious because basically it means that patients aren't getting seen soon enough who have lower extremity issues. They're not getting referred to care soon enough. We're really not doing a good enough job here. I think patients are afraid to come into medical practices, but it's very, very important that we see our high-risk patients and evaluate their feet and refer them as they need referral. Another area in which people have been afraid to come in has been with regard to coming to see the ophthalmologist. I think people consider going to the ophthalmologist risky because they have to get pretty darn close to the person looking at their eyes. But there's a study that they did in Israel where they found a 50% decrease in people coming in for their required anti-VEGF injections. So these are people who have very serious eye disease who aren't following up. So we really need to make sure our patients follow up with their eye health care because otherwise they can end up with serious sequelae. Finally, in the Lancet Psychiatry, there was a recent article published which isn't just about people with diabetes, but I thought this was interesting. So what they showed was that there was a relationship between people having had COVID and a subsequent increase in psychiatric diagnoses. Now, these are people who had not had a prior psychiatric diagnosis. And the most notable diagnoses were anxiety, mood disorders, insomnia, and depression. And they basically were smart in that they compared this to patients who were hospitalized for other causes like influenza, another virus, where they didn't find this increase in psychiatric diagnoses. They also found that this was a bidirectional association with psychiatric disorders, and there was a higher incidence of psychiatric diagnoses in the year prior to the COVID diagnoses as well. So having a psychiatric disorder may increase your risk for developing significant COVID infection, and having had COVID can increase the risk of psychiatric diagnoses. So this is something that's important to be aware of, as well as the stress and strain of dealing with this pandemic, which I think is increasing psychiatric issues and diagnoses across the board. So I think we need to continue with telemedicine. Like I said, I think it works great for people with diabetes as long as we have their data, and we can keep people healthy and home and out of the office if we have the data with which to manage them. But we must encourage our patients to come into the office if there is any concern that there's something we need to physically examine. People need to feel like our offices are safe and that they can come there without concern, but we really need to have patients come in who need to be examined. And we also need to encourage adherence with all necessary appointments. And I really take time out of every telemedicine visit to review whether someone's gone to the ophthalmologist, cardiologist, whoever else they need to see, to make sure that continues so we don't have a further increase in the harm that this pandemic is causing. And finally, the mental health toll of this pandemic is impacting everyone, and we should do our best to help connect people with appropriate resources to help them. This has been Dr. Ann Peters for Medscape. Thank you.